project is about regulating online pharmacies in low and middle income countries, and the project was undertaken in Kenya and India and receiving technical support from London School of Hygiene and Tropical Medicines.
So this workshop was a coming together of players in the public sector and players in the what we call the non-state actors. And the whole purpose of the workshop is we have had a lot of people discussing the merits and demerits of the current guidelines that are about online pharmacies. And so as Strathmore Business School, we thought we could take a lead in this just to make sure that we are reforming those guidelines.
This takes me back to when we launched the first online pharmacy. At that point, there were no guidelines or no blueprints on which to practice online pharmacy.
It's basically technology, it's e-commerce, powering what used to be traditional pharmacy models. And so that means the regulatory framework for traditional pharmacy models may not work very well.
I'm glad to have been invited in the research that was conducted in Kenya about the similarities and differences between online pharmacy services and what we call brick and mortar pharmacy services.
How do we create some regulation that cuts across? We've seen increasingly online pharmacies doing consultations, they're now doing lab work, home-based care, and we've also seen traditional clinical platforms now also selling medicines and whatnot.
We've had quite a bit of interest in that space because of growth in technology and demand by let me say, patients or customers for services which are more convenient to them. And it's something we cannot run away from. As much as the Pharmacy and Poisons Board already developed guidelines to steer this regulatory framework, there could be gaps, of course, and risks that we are seeing that need to be mitigated.
The patient interest comes first. If it's the e-pharmacy, then there's a way the patient, the recipient of care, has a good connection with the provider. That is on the communication strategy model, which will ensure that the patient really gets to be informed of the medication, the possible side effect, and even the outcome, so that it helps with improving the outcome.
In this new dispensation of technology, we have a heightened risk of cyber threats, of hacking, of data loss, and need to make sure that health data as a national strategic asset is secure. Our work is to ensure that the national resources are up and functioning.
I think is also the risk of selling prescription medicines without prescription. First, you need to authenticate that the prescription is from a duly qualified and licensed person who is authorized to prescribe those particular medications and within their scope of practice.
Then there is the issue of the sale of substandard and falsified medicines. This is because in the digital space, people feel invisible. The provider thinks that because you cannot see them, they can actually get away with some of these practices.
So smart regulation is a way to go. You could use a mix of instruments. So for example, you could use some government rules. It's still important to have rules. But beyond smart regulation, the other one is what we call responsive regulation. So responsive regulation is where the government or whichever public authority is enforcing regulation has what you call a pyramid of warnings and sanctions and actions that they take, depending on how the people who are being regulated behave. And the last thing to talk about is basically the value of partnerships in this type of regulation. So you have, health departments or ministries of health, you have communication authorities or Ministry of Information and Technology. So it's very helpful that this type of regulatory framework considers all these people within the room. So you cannot have pharmacists and pharmaceutical technologies sitting in a room to create rules that have all these other components. So everybody has to work together.